65-year-old man, it's a pretty important week to me. I try and keep myself as healthy as possible. And we were just sharing at the beginning of this a bit of a discussion about what a beautiful day it is, and just getting some sense of that, in kicking this off. We hope it's going to be a great week for everybody involved. Just seriously for a moment, I just wanted to kick off with a few fairly important statistics. Actually, they're quite frightening when you read them. But in the UK, the life expectancy for men is 4 years less than women. 1 man in 5 dies before the age of 65. Men are much less likely to use a general practice or visit a pharmacy than women are. And actually, and I know this from my own personal experience, much less likely to acknowledge illness or seek some help when they're not well. Probably most serious of all here is that 40% of men said it would take thoughts of suicide or self-harm to seek help. And just over 3 out of every 4 suicides, around 76%, are by men. And it's the biggest cause of death for men under 35. Topically, men are twice as likely to die of COVID than women. 87% of rough sleepers are men. That's an astounding statistic. Another one, 95% of the prison population are men, and 8.7% of men are dependent on alcohol when you compare to 3.5% for women. So, those are significant statistics and really underline the importance of what we're doing this week. What I'd like to highlight is that there's a lot of support available from us and lots of other agencies for people that are struggling with their health and well-being. And we do hope that during this week we'll help people to learn more about men's health and encourage them to seek help if they need it. So we'll be posting lots of links to resources in the chat box this morning, and there'll be lots of opportunity to make contact throughout the week. So we've got some fantastic presenters this morning. We've got Dr. Alex George, who's with us, and also the fantastic Kofi Smiles, who you probably know very well as BBC Radio Humberside's breakfast presenter. So we're really delighted to have both of you with us. Alex is an A&E and TV doctor and a best-selling author and a youth mental health ambassador to the government. So I don't know what else he does, but that sounds like a fairly busy set of responsibilities. He's very well known across the UK, and he's a respected healthcare professional, and bringing the nation accessible and reassuring advice directly from your job at the front line. And that's a pretty tough job, Alex, at the moment. Outside of the hospital, Alex is on a mission to make mental health education compulsory in schools, and he's become prolific throughout the UK in his campaigning with a number of charities. He's also, on top of everything else, written a book, Live Well Every Day, and that was published in May of this year and is a Sunday Times #1 best seller. And as I said, he's now been appointed by the Prime Minister as a youth mental health ambassador to the government. So we're very fortunate to have you with us, Alex, and you too, Kofi. So I think I'm handing over to you now, Alex. Thank you.
Thank you so much. Thank you for that introduction. And thank you to everyone that's joined this morning. And Kofi, we've obviously met the other week, didn't we? But yeah. I think hearing those stats and things that you've mentioned already, sadly, a lot of that isn't surprising, but it is still shocking. And so I'm quite excited for us to kind of go through this today and hopefully kind of uncover some of the reasons why it might be happening and some of the things that we might be able to do to have some kind of solutions.
Yeah, and I think it's welcome at this time as well, where we've all roughly experienced the same thing during the pandemic, and people more and more so aware of, the importance of the mental and your physical health and how they sort of, it's like yin and yang, really, isn't it? They work together, they affect each other, and I think, using today, and like Stephen said, there's going to be opportunities to have any of the resources posted in the chat box. Also, I'll add as well, if anybody's got any questions, any thoughts, anything you'd like to add, feel free to bang it in the chat box as well, because Jade is going to be monitoring the questions and feeding them through to myself, and we'll leave some time at the end so we can put them through to Alex as well. Honestly, ask anything, ask absolutely anything, because everybody's going to have their own unique perspective and point of view on all of the angles that we're going to be on, all the topics that we're covering today. So, you know, you might think, okay, this might not be of interest to anyone, but only you are going to read into this sort of session in your own unique way, that in a way that nobody else here might have done so. So you might be asking questions and introducing some people to something new. But yes, Alex, you've got all these accolades. I thought we weren't going to have any time to have a conversation, but it's amazing, because that just proves that you're the right person to have with us here for Mental Health Week. So I just want to jump straight into it, because quite often I think quite a lot of the focus for men is on their physical health. You know, we see it all over Instagram. People are influenced by film and TV. It's all about the physical health. But, you know, more and more so, we're hearing conversations that mental health amongst men is a conversation that needs to be had. So I just want to start with asking, why is it important to talk about mental health? And can you define mental health for us, please?
Perfect. I'll jump into that in a moment, Kevin. But first, thank you very much for your kind words. And also, I should say thank you to everyone, all of you that are on this call, because we've all had a difficult year across the NHS and health sector and whatever. So thank you to all of you for your hard work. And you know, I've got so many friends in different roles in the NHS, and everyone's found it very hard. So just want to take a moment and say thank you, because sometimes we forget to do that. I think you're right. I think mental health and physical health, for far too long, I think we've separated it so much. And it's quite interesting, if you look at medicine, historically, we've really been very, very good at like splitting everything up into like, oh, this is physical health problems, cardiology, respiratory, you know, kidneys, all these different specialties and areas. And then we have mental health over here. We've kind of really neatly pushed it into this kind of corner and gone, well, that's that, and this is everything else. And in reality, I think perhaps the mistake we've made is that the connection between the two has kind of been lost. And I find it quite interesting. You know, I've been reminded of this, I think, quite a lot in A&E. And I remember one particular case that really struck home for me was I saw this late 20s gentleman come in playing football. He had a horrific tib fib fracture of his lower leg, open fracture, really nasty fracture from a tackle. And, you know, my focus, my colleagues and nurses, everyone's focus was on his leg, and we need to straighten it. We need to, you know, we're going to pull it. We need a cast. We need orthopedics. We need surgery. We're all worried about the physical issue. And, you know, my conversations with him were all about the leg and, you know, what he's going to need next. And the thing that he said, you know, when I was talking to him and I explained all, you know, what's going to happen next and what we're going to do, his worry was, but this is my life. I love playing football. You know, what if I can't play football again? You know, I'm going to be so miserable. You know, this is what I live for, is to play football at the weekends. And I was like, wow, I literally was so focused in on this kind of the leg, that actually everything else is forgotten. And if you think about any illness, it might be diabetes, it might be having a heart attack. What's the impact on a person's life? How does that affect their mental health, their confidence, their ability to do the things they enjoy? Because ultimately that affects here as well. And so much, I think, of physical illness can sometimes be a real symptom almost of mental health. You might take, for example, and I use this, and it obviously is not for everyone, but it may well be that if you're very depressed, maybe you have you eat, you know, and your relationship with food is altered because of that. Maybe then go on to have physical issues as a result, maybe diabetes or whatever. But actually, the underlying thing, if you stepped all the way back, might have been from a mental health perspective. And so I think we need to take that more approach that actually can't really separate the two. And what's good for the body is probably good for the mind, and what's bad for the mind is probably also quite bad for the body. And in terms of defining mental health, the way I see it is mental health is all-encompassing. So you've got the spectrum. At one end, you've got perfect mental health. God knows who has that. And then at the other end, you've got really bad mental health. And most of us in life are probably moving up and down, you know, on this spectrum for various reasons. Sometimes there's a good reason for it. Well, we might drop down, things aren't good, maybe something happens in your life. Maybe it drops down for no reason, and we don't understand why we feel bad. Other times we might have really great mental health. It'll be at this end. And I think a big part of it is learning and realizing, you know, why do we feel this way? What can we do about it? How can we stay at this end of that spectrum? On that spectrum, then, of course, mental illness, which would be at one end. Well-being is, I guess, a catch-all phrase for generally means positive well-being, so what you do to look after yourself, and self-care. People talk about generally doing things that are beneficial for their mental and their physical health. I think it's useful to discuss that terminology, because sometimes we just kind of throw it around quite a lot, don't we?
Yeah, sorry, I forgot I was on mute there. Yeah, I think you briefly touched upon it about how it is an illness, but I don't think people still it's still taking its time to I think people are taking the time to sort of understand that mental health issues are illnesses. So how do we get more people to understand that it is an illness, it is something to be taken seriously, and that just because it's not physical, it's not something like you can see, like with that gentleman's leg, that you need to take a bit of time on it. It's something that needs to be paid some attention.
Well, I think that there's a huge shift in realization at how important it is. When I went to med school, to be honest, because I wanted to be an A&E doctor. I wanted the kind of action, running around, cardiac arrest, doing all those things, and I didn't really think about mental health as part of the job in A&E. Like, I really didn't, even when I graduated, until I started working. So I graduated and I went as an F1 doctor to King's in 2015, and I've been in Lewisham ever since, and I've been in A&E there since I think 2016, 2017. And when I started really going to A&E and being involved in that kind of world, I realized how much mental illness we see. And I use that word carefully because, again, mental health is all encompassing, illness is very specific. But we see so much of it, and often we see physical presentations, but find out that the line behind that is an illness. And I think you're right. I think a big part of it is, what can you see? People often can see physical illness or signs of that, and they will respond to it much quicker. Like, Kofi, if you had a bad ankle and it was really hurting you, how many days would it be before you go, this ankle is hurting me, I'm going to go and get it checked out? A couple of days, might leave it a week. Probably not going to leave it much more than 2 weeks. If you're like, this is real, this is a nuisance affecting my daily life. But we often leave the mental health stuff for a long time. In fact, I was reading a report the other day from Children and Young People, and on average, it takes up to a decade for people to have a diagnosis or begin to have treatment from their first symptom of mental illness. So wow. But if it makes sense, I'm currently having treatment for I'm on medication and therapy for anxiety, but my anxiety symptoms probably started about 15 years ago. I mean, I really have had quite bad anxiety for at least 10 years, but never kind of dealt with that, or at least formally dealt with it in that. And a big shift of what we've had to do is, yes, to accept mental illness and realize mental illness, and also, I guess, change the culture whereby it is socially acceptable to come forward and receive treatment for mental illness, because it's still the case that people are very embarrassed to take medication, mental health medication. I say openly, I'm on sertraline, no issue. I don't have a problem saying that. But I know that, I understand that for a lot of people, that isn't the same. You can take something and say, I'm taking a statin, I'm taking an aspirin, I'm taking these medications for my heart, but saying that you're on a medication for your mind, it still carries that weight. And I think that's one of the things we really have to tackle if we're going to get mental illness accepted much more.
It's interesting because I'm curious, how many hours, roughly, would you spend in training looking at mental health? Is that something that's covered massively, or is it something that you would maybe have to do as a separate elective if you have a specific interest in it?
So when I was at med school, I would say that it was, a small percentage. I couldn't say probably like 5% or something like that of the total learning, I would say. I hope that's changed. I suspect it's probably not gone far enough, but it wasn't a lot. And it was done in a very certain way. What I find very interesting, so when I was at medical school, just for context, I was studying down in Peninsula Medical School at the time. It's now changed, Exeter, Plymouth, Truro. And I really enjoyed the first 3 years, really enjoyed it. I was loving it. It was great. And in the fourth year, I was down in Truro, which is actually a beautiful part of the country, a very sunny part of the country. But for some reason, I just completely lost myself. I really just wasn't right. I wasn't sleeping well, wasn't really exercising, wasn't seeing my friends, lost interest in my studies, just really didn't feel myself. And looking back, I had mild depression, but I really didn't want to admit to that. And I really didn't realize how much, how much it was affecting me. I eventually realized I probably need to speak to someone, and I was way too ashamed to speak to med schools. I thought if I tell them, they might stop me being a doctor or hold me back or whatever. So I called my mum. Really? I called my mum. Yeah, it's shocking to think that now, and I look back with a real sense of sadness that I felt that way, and I really did feel that way. I didn't feel great, and I really wouldn't speak to them. So I rang my mum and said, this is how I feel. And my mum works in a bank. She's not medical at all, but had great advice and said, but Alex, you're not doing anything that's conducive with feeling happy. Like everything you're doing is, you're not sleeping well, you're eating terribly, you're not exercising, not seeing your friends, you don't speak to anyone, you're not kind of dealing with any of the issues. And I thought, wow, that makes quite a lot of sense. So I started with the basics, and this is where the lifestyle element of things come from. I was like, right, let's get some natural light each morning. Let's actually go for a walk. Let's start exercising again. I'm going to go to bed at the same time, get up at the same time. I'm going to make plans, speak to my friends. I'm going to talk to my mum every day about some of the thoughts I'm having and deal with them. And at first, I didn't feel better for a good few weeks, but after a month or so, it made a huge difference. And the two things that really shocked me, number one was obviously the stigma element, that I didn't feel I could speak to med school, but secondly, that I was nearly graduating as a doctor, or most of the way through, and I didn't really understand how important it was, for self-care, looking after yourself, and how important that is. Now, of course, I'm not saying that looking after yourself and self-care is a treatment for illness. That's not what I'm saying at all, but it's an important element of care. And actually, I've spoken to many experts within this mental health field over the last couple of years, and particularly since being in the role. And, this element of self-care is really, really important. Even if you're undergoing multiple medication treatments, therapies, interventions, it's still important, fundamental to how we feel. But I was shocked. I really didn't realise that. And now that's why I reflect so much and think, gosh, if as a medical student, as in someone that's nearly a doctor, I didn't feel or didn't have that knowledge, how do we expect other people in the society who are not to have that?
But it just shows you the state of the culture that was set up at the time, and hopefully it feels like it's changed. I mean, like, we would talk about looking at, you talk about going out, speaking to your mum, getting some more natural light. There's all these little things that can sort of help you on this journey. But what can be done? Can we be looking at mental and physical health in the same way? Should we be treating them in the same way, or do we need a complete overhaul of what mental health is? Are we seeing them as two separate things, but also remembering people to sort of like see them as mental and physical health as something that can be paired, should be paired?
Well, look, I mean, my role as Youth Mental Health Ambassador is twofold. One is to be a voice for young people, and secondly is to amplify movements and expertise of those who are experts in these areas. So whether that be psychiatrists, whether it be psychologists, educational experts, it's really to amplify those movements. And I spend a huge amount of time talking to everyone, really, charity sectors, professionals, NHS, to find out what is the answer. And I think the answer is complex, and I'm sure there's a lot of people on this call that would agree it's very complex. There's no one thing that's going to fix this. But one thing I think is very important in terms of when you look specifically at emotional literacy, people being more open, changing the stigma, and I think understanding more about self-care. School is very, very important, and creating a whole school approach to mental health, specifically around well-being, and getting young people to have emotional literacy. Essentially what that really means is that as you're growing up, you're able to put into words, you're able to voice how you feel and understand it, labels the feelings. Because it's quite interesting. I was chatting to a child psychiatrist about this, and a lot of the time behavior at school, when we look at kids, go, oh, that's a naughty kid, this behavior, that's a naughty kid. A lot of that is them not knowing how to express how they feel inside, and therefore it is expressed as a behavior. And actually it makes a lot of sense. If you've got a girlfriend, boyfriend at home, when you're stressed, often you don't know you're stressed. They say you're being snappy, you're being moody, or you're changing your behavior. Those are often, it's our behaviors that come out even as adults. So we're not always good as adults at being emotionally literate. And so if we teach kids this from a young age, we'll help tackle the stigma. They'll understand how to put labels and understand how to voice things that are issues, to speak to people, and also hopefully understand a little bit about self-care and what to do when things go wrong. And I think that is a big part of it, and that will help as people grow up through generations to change the overall culture. Because one thing I found that is challenging, trying to get people to talk about mental health at higher levels is hard, because it is a topic that everyone still feels quite uncomfortable about. People, that's something difficult. There is a stigma still around mental health, and to actually fix that and fix things like funding and CAMS and all these things that need to be funded, and have money. And I think a big part of it is getting the right people engaged and feeling positive about this rather than being negative.
Because it's all over social media. You see it all over like Instagram. There's all these accounts. It's on TikTok as well. And I love the fact that, I was always thought, what is the terminology around this? Emotional literacy is the right thing. How do you make emotional literacy? How do you make that normal in a world full of perfectionism, in a world full of trolls? Do you know what I mean? In a world full of desktop psychiatrist. You know what I mean? Because that's what seems to be popping up everywhere. How do you know what information to trust, who to trust?
Yeah, social media is that's a whole kettle of fish, that is. And I'm working. A big focus of mine is around anti-bullying, and I think it would be shocking if I shared some of this work I've been doing with Diana Award. 50%, 1 in 2 young people we've surveyed, many thousands of young people aging between primary school to all the way up to beginning of university or 18 years old. 50% of them are bullied at any one time, whether online or on person. And we know that bullying has a significant impact on the person's happiness, their education, and sadly, the links that are made with mental health. I mean, if you speak to anyone that's been bullied, you can kind of say how much that can impact the way that they feel. And I think it's one, like, social media is a good example of, like, what do you do about it? How do you fix is dealing with bullying online just getting rid of social media? Of course it isn't. And in the work that I've been doing and kind of looking into the research and speaking to people, the problem is there is many people that say that social media is a benefit to their mental health, as there are people that say that it's a hindrance. If the question is, can social media damage your mental health? Absolutely. But is it good or bad? That's a very different question, because many people find it for movements, whether it's like activism on climate change, whether it's support groups that are made on Facebook, whether it's positive accounts on Instagram. There's a complete yin and yang. And when it comes to finding the right information about mental health, and I think you've got to, and this stands for everything. Vaccines is everything. Making sure you go into reliable sources, of information, and look at who is giving you this information. Why are they doing it? What's their motive for that information? And often just going and making sure you're using the NHS, you're talking to your doctor, and at schools and things. If we're teaching about mental health at schools, it comes from a place of being on the curriculum and etc. And on that point around curriculum, just before I stop waffling on, the big thing that we need to do is to make mental health sit alongside other core subjects on the curriculum. So, there is really, really, really good evidence that ultimately happy and healthy children are more likely to be engaged at school and in their learning. It's pretty obvious, really. I'm not saying anything that's particularly surprising, but it really does. It does matter. I think we just need to focus in on, hone in on that it really is important that we, why do we care about well-being? Because ultimately, not only do we want happy children, surely that's like there's a moral element to that, an ethical thing, that we want our children to be happy and safe, but also they will be better and they'll perform better. And actually at schools I've visited where mental health support teams have been integrated, they've got mental health leads, mental health first aiders, the report from teachers around what it's like to work at the school, the behaviour of children, the attendance of children, it makes a huge difference. So it does work, and I think we do need to push more to get this curriculum changed.
It's that I found it really interesting, because based on what you've said, and like we just had a message pop up in the chat from Sarah. I know that I'm going to save messages for the end, but is there any sort of responsibility from the parents at home? Does it start at home? Are the parents the one that let their children know that it's normal to tell people how you feel? It's normal to set boundaries, because quite a lot of the time it's like, school should be doing this, school should be doing that. Yes, the school is part of the growing education of a child, but there's that phrase, it goes out to that old idiom, isn't it? It takes a village to raise a child. So they've got to get these bits of information from all over the place. So how much of it does it rely on the parents? And I know that there will be parents here. I'm not having to go at you. Parents are busy. You've got your own lives. You've got to look after your kids. You've got to go to work. But does it start at home?
Well, it's interesting. My mum, I lost my brother a year ago to suicide, and that's a big part of what fuels me in the work that I'm doing. But my mum says that it's almost like trying to fly a plane with no driving lessons. It's trying to be. I'd imagine, I don't know, I haven't got children, but imagine having a child like that sometimes anyway. I don't know, but this is what my mum was saying, is that it's very hard because you don't know. With mental health, it's something that my mum said, I was never taught about it at school. I was never taught anything about it. I didn't know. All I know about it is from the work, some of the stuff that you've done, and that's why I think it's so important to arm yourself basically as much knowledge as you can. And I think that charities such as Young Mind, for example, Young Minds, which I think I work with them so much and they're amazing, they've really focused and honed in on that idea that we need to arm parents as much as we do children and teachers. So they've got amazing resources on there. If you go onto Young Mind's website and you click through, you can see that they've got resources for parents I think that is really important. That's a fundamental thing we need to think about, and particularly with the mental health support teams integrating to schools across the country, is to think about the parents as much as the children, because part of it is dealing with a child who might be struggling, but it's also with the parents as well, because it's things like, for example, a natural instinct as a parent or a friend, if someone is struggling, to go in and fix it, right? We want to fix things, we want to make things better. But by trying to fix things, often we can sometimes make things worse. You know, I've just finished filming the BBC documentary Children in Need, which is going to be looking into, basically, it's going to be, my mission was to give young people a voice, and I hope this documentary will help doing that. But one of the things I've found really interesting is speaking to people and hearing from parents saying, well, actually, you know, our natural instinct is to fix, but sometimes by doing that we make things worse. And sometimes it's listening and understanding and being there to go through the journey with that person, rather than by trying to be a catalyst of sorting it out. And I think that's, you know, same for at work. You know, we've got colleagues at work, you know, and I've had it myself, where someone's come and said, look, I'm really struggling. I just, you know, this has been really hard. I'm not in a good place. And you just went, oh gosh, like, you know, you're going to be fine, and fix the whole thing. But really what you want to do is be there, listen, understand, say, look, why don't we go for a walk, or start doing, you know, let's spend some time doing something, go for coffee, whatever. But you know what, let's signpost you to people who are professionals who are there to actually help you, and I'll be there as your friend, rather than me be there to try and fix you. It's a subtle change, but it is important. And also it takes that element and burden off ourselves, because, you know, actually, in actual fact, if your child has a severe mental health illness, it's not for the parent to fix them. You're not a mental health professional. You know, it's like for my brother, I'm not a mental health professional. So, you know, we weren't aware of his struggles, but it wouldn't have been my job to fix him, even if I was aware, because I'm not a mental health professional, and as a family member, you shouldn't be trying to treat someone. So my job, for fear, if I had have known, would have been there to be there as his brother, and that's an important distinction.
I think, you know, I'm glad you said that, because there'll be people here listening maybe who are too hard on themselves purely because of love. Do you know what I mean? And there's nothing wrong with that, because you love someone, you care about someone, you want them to feel good, you want to try and take that pain away. And, you know, it's such a valuable message to say, look, be the parent, be the friend, be the. But I've never considered it like that, because you feel like, as your role as a maybe even as a son, you know, as an older brother, younger brother, you feel like, well, it's my job as kin to sort of take that away. So I'm writing all these notes down as well. Thank you very much.
But it's a distinct thing, and it's something that you know, something that it's not something I've learned it from other people. It's like you and a lot of people going, look, you know, when you try to fix things, you create barriers and boundaries, and it's like, especially with children. I mean, you know, like trying to go and ask them questions, you're trying to know, you know, it just makes the walls come up. And they go, I'm fine. So it's creating an open space, listening, and true listening without judgment, without necessary action, and just being there to go, well, what do you want to do? What would you like to, how would you, same with bullying. I think, you know, I was bullied at school. My parents were gung-ho, kind of come in and just like, you know, this is what we're doing, and I'm going to go through the front door of the school. And it just meant that I didn't tell them. Whereas if they'd have said, you know, and I never say this, where they just said, what would you like to do? And we make a joint decision where I feel empowered as the person who's going through it to be involved in that decision making and decide what we agree the boundaries will be, I probably would have told them. But instead I didn't, and I went through 2 years of whatever to, you know, when it could have been sorted. And that's no judgment on my parents, because, you know, we're all learning, we're all trying to do our best. But I think I think we are understanding more and more now that sometimes not acting and not trying to fix is a big part of getting it right.
You're right with the parent situation there. It was like, well, you know, you tell them something, they will storm the doors. You know what I mean? It'd be like a scene out of Lord of the Rings or Game of Thrones, isn't it? You know what I mean? Nothing will be getting in their way.
It's the last thing you want. It's the last thing you want. But similarly, if you're struggling and you're feeling sad or you're feeling anxious, take anxiety as probably really good. If you're feeling really anxious, the last thing you want is your parents to be coming in and going, right, we're doing this, this, and this, and this is going to fix you. This is going to do it, and it can actually just make more problems.
Honestly, I'll come back to some of the things I want to talk about, but I think there seems to be a bit of a noise about creating barriers and interesting points around fixing. So I think I want to sit in this space and talk a little bit more about normal behaviors. Now, normal behaviors, you know, finding those right moments of engagement for parents to either communicate with each other, communicate with their partner, communicate with the kids, and just basically creating that family dynamic. How do you create that space? How do you create that openness? You know, for the parents out there thinking, look, I want to talk to my child, I want to talk to my partner about, you know, communication techniques. How do we do that? Do you know what I mean? How can they do that without causing it to making it seem like a thing, or making it seem heavier than it is, and making it a natural part of, the I guess, the family's day to day?
Yeah. Well, what I might do is I'll talk a little bit about, like, maybe how to approach a situation where you're worried about brother, friend, child, colleague, and then I might talk a little bit about, like, language and how you can create more openness.
Sure.
So we've all been in that situation where it might be at work, or it might be at home, it might be sibling, where you go, they're not themselves at the moment. Your gut is telling you that they're not themselves. You can't necessarily say this is why, but there's something not right. And approaching that can feel awkward sometimes. Well, how do I don't want to offend them or cause a problem? And it's important to do it in the right way. And I always think, if your gut feeling says there's something wrong, there probably is. So trust your gut. That's the first thing. The second thing is time. Is it the right time to have this conversation? Are we in the queue for Tesco's? Are we in the canteen of A&E? And there's loads of people around. Is it really appropriate to talk to them? So I think the right time to talk to them that's appropriate, the right place, so a quiet space you can have a sit down and talk. It might be on a walk, whatever, and find the right moment basically to do it, right? And then when it comes to approaching it, be quite straight to the point. We jog around the issue, carry our own stigmas around it. We worry about what stigmas we're placing on someone else. We almost avoid it sometimes. So it's really important just to come forward and say, actually, and it's very important to say, you're not applying the labels to them. So it's important not to judge someone, but say, look, I just feel like you don't seem yourself at the moment. X, Y, and Z. You might want to say why, and say, just want to check, how are you? How are you doing? Is there anything you want to talk about, or can I help you in any way? Give that person open space. Sometimes people go, I'm fine, because it's a very British response. And in which case you can say, well, no worries at all, but I just want you to know I am here for you. And then use an opportunity whenever you can to ask again. So it's Ask Twice campaign by Time to Change, which I think is brilliant. And the first time you ask is seeding that thought in their minds. And the second time might be a text, it might be a week later, and you're checking in and giving them that real opportunity to open up. Because often if someone wants to, they might have it the first time. By the second time, if they're going to talk to you about it, they probably will. And the important thing is, when people do talk to you, is, again, don't try and fix it. It's not your job to fix them. Be there to listen, to hear, and then to signpost. So, whether it's work, whether it's at school, whether it's whatever it is, where do you signpost them to? And that's why it's so important for people to remember places of support. It's not just for you, but when you're in that situation where someone says to you they need help, you've got somewhere helpful. Now, I'm sure there's lots of support that you mentioned locally there, but if you're going to remember one place, Hub of Hope is incredible. And our Hub of Hope is quite new. What they've done is they've collated all the support, NHS, charity, and otherwise, onto a website. You put your postcode in, and it tells you all the support that's available in your locality, what they do, how you access them, and the number. And that is great, because then you're not trying to remember Samaritans, Young Minds, this, whatever. Give them that, and they'll be able to find it. And then just be there. Walk with that person through that process. Just be there. Always think, am I being their friend here, or am I trying to fix them? Be their friend. Okay, so that's how I say a package how to approach that situation. In terms of creating these cycle of ideas, I'm not claiming these at all, but brilliant ideas around creating a family openness, I guess, around mental health and talking about it. The traffic light system, actually used it in certain A&Es. St Thomas's A&E, I interviewed a senior sister there. It was amazing, actually. She was talking about how they've integrated into A&E, ITU, particularly throughout the COVID time. And basically what they do is they'll, at the morning ward round, they kind of meet together with all the nurses that are on shift that day. They do the traffic light system, so green, amber, red. And they go around the room and you say whether you're feeling, just generally if you're going to put yourself as green, amber, red, what are you? Green, amber, red. And then it allows the senior nursing staff, senior sisters, to identify who might need a bit of help that day and who's really struggling. And then they can identify that person and support them. And actually, if you turn that and you take that idea and you put it into the household, what if, say, at dinner time every day, or breakfast time, whenever's appropriate, where you sit around the table, what if you go around the family and do that, the same thing, to do that? And the reason that I think it's so powerful is it breaks that intergenerational kind of weirdness about mental health. If you've got, I'm just going to we're talking about men's health. The dad might sat there going, today I'm amber, stressful day at work, this went wrong, but actually I got my exercise in and it's a weekend tomorrow. So I'm in the middle, but I'm not having my best day. and then you go on to the next person. The children around the table do the same. And what it does is it breaks those barriers. It allows people in the room to identify someone that's red or might be struggling, but also allows you to identify when someone's green. Okay, why are you feeling green today? Well, I got exercise, got out today. I really enjoyed class today. I've done my whatever. And you're learning about not just about when people are struggling, but when it goes well, you're ingraining that element of like, well, why was your day good? What did you do today that actually meant that it was good? And they might seem little things. It makes a difference. And when you're trying to communicate around mental health, sometimes take away the weighty words. Are you feeling depressed? Are you sad? Are you angry? How's the weather today? Well, it's cloudy. It's all right today. It's not amazing. It's cloudy. It's a sunny day. Oh, it's rainy today. Use words that are less emotive, because sometimes the words of mental health, they're pretty downtrodden, aren't they? Really, they're kind of like depressing. Sorry to use the pun, but they are sometimes. So change the words to less emotionally heavy words. I think is quite a benefit.
And I guess they can be a little bit misleading, can't they? If someone's not really feeling like that, but they've heard it, they're like, oh, actually, yeah, maybe. I think it's sensational. And what we've seen, like with techniques like the traffic light system, especially amongst like an NHS staff, an NHS family, a shift family, where does that come in? Is that down to management staff, or can anybody, any part of the team, but look, I think we should do this to make it part and parcel? Is it something that needs to trickle down from the top?
I've had this conversation a lot across, particularly amongst the NHS, because let's be completely frank, there is a problem in the NHS with regards to burnouts, with regards to overworking and stress. I mean, we just know that. I mean, and the pandemic hasn't created that; it's added on to that. And I'm sure, and I'd love to hear from, I'm sure a lot of those on this call will be able to kind of comment on that, but it's added to the existing level of stress and burnout that's there. I was at conference Association of Surgeons in Training, and they did a survey, and 80% of the surgeons in training were displaying signs of anxiety, depression, or burnout. So that's a significant proportion of that workforce in that situation. But whose job is it? I mean, whose job is it? And again, this is so complicated. I think very much it does actually come from a lot from the top. But I do think if you think of the day-to-day, forget the highest level of politics of it all, I think it is a top-down, bottom-up approach. It's everyone's job, basically. Right. How can we do that? You know, if you're an assistant in charge of a staff in IT, or whether it's the doctors at handover in A&E, you know, why can't we integrate that kind of system? How can we change the culture? I mean, we one thing we've done in Lewisham is that we've created wellbeing room, which sounds like something really small, and actually in reality what we did is we found pretty much something that was bigger than a cupboard. We ripped out all the stuff in it. We put lamps in it, a couch, a little radio, some plants, made it into a quiet space, to use that space basically for people not to go and eat and whatever. When you see a difficult case or you just need a moment, you just go in there. Some people call it a wobble room. I don't like that because I think wobble has a negative connotation. I think it's good to actually take time. But anyway, using that space to go and stop. Now, people thought at the start, no one's going to use it. It'll be empty, and people love it. People really use it. I've used it. Other people used it. You know, you just need a moment. You just want to go and sit there for 5 minutes. You can either get away from the noise, the bells, the clinical stuff, and just have a moment, and it being really beneficial. But it's just one aspect to all the changes that are needed. But we do need to take that change. You know, in Lewisham now we've got a mental health ambassador who's one of the consultants. We've got mental health first aiders who are staff across the board, a cross section of staff that are first aid trained, and basically working together to look at programs of wellbeing that we can do and how we can actually improve staff wellbeing, but also look at how do we support staff better when it goes wrong. So I think it's everyone's responsibility, basically.
And is it, you know, this is the type of things that can help drive, I guess, compassion and kindness, and I guess amongst each other. And that's the type of thing, that's the type of stuff that's going to keep people in. Because as you said, you know, people are leaving the NHS in droves, and it's, I don't work within the industry, so I'm not sure what's, you know, really pushing people out. It could be a whole myriad of things.
To work. I think the reality is it's really hard. I mean, it's not just the workload. I mean, you know, in Lewisham, we're a reasonable sized district general hospital, but we're seeing, you know, ridiculous numbers of patients. I mean, we saw like I think the other week we had 520 patients come through the doors of A&E in 24 hours. I mean, that's a lot for a district general hospital. 20 years ago, that was less than half that number. You know, so the pressure's increasing. The staff size isn't necessarily increased with it to cope, and that results on pressure on the people. That's what's happening. I think we need to kind of realise that. I don't know what the answer is. I think it's not a quick fix, but it's something that needs to be done.
I'm like, you guys are essentially, you're a team. Do you know what I mean? You're like the Avengers these days. You know, what more can be done for people to be able to look out for each other? What more can be done for you to be able to, like, you know, show that kindness, show that compassion?
Well, I think the big thing we've tried to change, and I think that it has one of the few positives of the pandemic, is that I think kindness within the hospital's probably got a bit better amongst colleagues. However, what we've actually seen, and one of the recent reports was on the news as well, was, you know, actually violence against staff has gone through the roof. It's much higher, you know, in a lot of hospitals. You know, Lewisham, I know, has had problems with that. So actually, part of it is people realising, geez, you know, we're under pressure in the NHS, you know, we're up against it. But I think within the NHS, very important we keep building upon that work, because actually the NHS isn't always the kindest place to work. You know, it can be really hard sometimes, and people can be hierarchy, creates its own issues at times. And I think pressure on people means people pass pressure onto other people, and sometimes it's not done in the right way, and sometimes the way we speak to each other isn't perfect, it isn't right. So I think that is another big part, because actually when you're going through a difficult time, you need to pull together. I think the pandemic, we've done that well. We need to carry that on, because actually the last thing you want to do is, you know, have difficulties between, you know, specialties and each other at a time that you're all just trying to do your best.
Mm-hmm. I'm looking at the time now, it's 1:15. I'll just refer to Jade. I'm not sure when you wanted to do the questions from the audience. There's quite a lot that have come through, and I don't want to do any of the attendees any disservice. Should we start going through them, because there's some really, really good ones that I actually want to hear the answers to as well. So I'm a bit selfish. So Jade, what do you think?
Yeah, so what I'm thinking is we have got quite a lot of questions. So yeah. I think if everyone's familiar with the hand up function at the top of Teams. So if you just look at the top of your toolbar, there's a little emoji with a hand up. If you want to ask your question to Alex now, if you pop your hand up, and we'll start working through as many of those as we can, and then we'll have a chat, Alex, afterwards. And maybe if there's some of the questions we can't get through, if you'd be willing to, if you've got the time, maybe answer some of those questions afterwards, and we can send that out as a resource.
Sure.
So I'll just have a look as those are starting to pop. I think I've just seen a hand pop up there.
Yeah.
So Rebecca, if you're happy, Sophie, do you want me to go to people, or do you want to go out to them?
I can go to them, because Rebecca was the first one I had in the chat box. So we can go to Rebecca. Rebecca, you can read out yourself. I can read out the question for you. It's up to you. Is she there, Rebecca?
Yeah, I'm here.
There we go. Do you want to ask Alex your question?
Yeah, so I lead on foster care in Lincolnshire, and we put lots of support in place, and we have lots of training and workshops, and, you know, all support groups and things, particularly in regards to supporting around secondary trauma and compassion fatigue. Now, one of the things that we find is, overall, the majority of the foster carers that come forward to access support are females as the main carers. So it's about how do we, how are we more accessible? How do we get more males to come forward as part of those households?
Well, first of all, thank you for the work you're doing. It must be very challenging at times, but well, I can only imagine. But yeah, it is an issue, isn't it? And I think right at the start of this conversation, Stephen touched upon the point. If getting men to come forward in general is very challenging. Actually, it took me back to kind of A&E. I'm just thinking, like, the number of times I've sat there. Stood there by the bed and speaking to someone who's, you know, a man who's come in typically at a certain age in their 50s, and they've had chest pain for 3 days, and they've waited and actually suffered, you know, significantly more damage to their cardiac tissue because they've waited several days, versus, you know, women who are often much better at coming in. It happens so often, and I think so much of it goes, and we haven't really addressed it directly, but toxic masculinity, expectations of men being tough, not needing support, you know, I don't need this kind of thing, is still a huge issue, and in mental health, I think it's probably more so than anywhere else. And I think the answer is, again, no quick fix. I think a big part of it is societal change. A big part of it is what we're trying to do at schools, and change that. But within, you know, for yourselves, I think it's just trying to be as open as I'm sure you are as a service, maybe, I don't know if we can target somehow men with any campaigns or reaching out to them. Maybe it's hearing from men and finding out, well, what would what do you need to feel more comfortable to come forward? But it is a challenge. It is a real challenge, and one of the big parts of, I guess, that I'm trying to work on in the role, is trying to change people's attitudes to it. I think campaigns around that, getting men talking more, other men seeing other men talking, it is powerful. And sometimes I think I know it's easy to go, oh yeah, we're all talking, whatever, but it does make a difference. But keep doing what you're doing. It's not easy, and I really hope it does change, because far too many men actually suffer in silence rather than getting help, which would make a huge difference.
Awesome. I've got James Royal's hand up, but I've also compiled a list of some of the questions that are in the chat. So James, do you want to go? Do you want to ask Alex your question?
Yeah, thank you, Kofi. Hi, Alex. So my question I put in the chat was just around why is it that you think that medics seem so reluctant to talk about their mental health? I work in Leeds Teaching Hospitals Trust, and we've literally the last 6 weeks ago, we set up like a men's health and wellbeing network. So we're just in the process of getting that off the ground. And one of the kind of things that we kind of had in the process is we were kind of getting feedback that we know potentially a lot of medics won't actually attend that. So I just wondered why you think that might be. We did actually have some people turn up, which was actually really good. So we had a couple of doctors that were really good. But just moving forward in terms of how we can kind of target medics would be really good.
That's first of all, thank you. That's really awesome, and I'm really glad to hear that, because I think for too long we probably ignored the issue a little bit. I think if we're honest about it, so thank you for that work that you're doing. I think a big part of it amongst medics comes down to this, like, I can't be seen to be not failing, and it goes back to when I was in my 4th year. I didn't want to talk to the med school because I thought they would think Alex is not a good doctor, or he won't be a good doctor, because if he's struggling, how can he be a doctor? That is, I think, the fundamental. I think as medics, often the competitive element, the hierarchical, the constant, pushing to kind of get better. If there's a sign of weakness, you almost think you're going to be prejudiced because of that. And I think a big part of it is trying to make this culture on medics being like, look, we all work quite hard. It's pretty damn stressful. The hours are crazy. It's pretty normal to find things tough sometimes and to need help. And I think creating that culture of it is the start. But I think it almost in answer to the question, in doing what you're doing that, if that makes sense. A few people might come, and then a few more might come. They'll tell people, and they realise actually it's quite normal. People going on to this is actually pretty helpful. It will change, but it will take time. It will take time, and I think more work, particularly around integrating, going into the hierarchy and getting consultants to come along, or getting consultants to be mental health ambassadors like we have in A&E. What message does that send? We've got our ambassador is an incredible doctor, incredibly highly skilled, incredible at her job, and she's very open about talking about mental health, and she's an ambassador there at the trust. So that tells all the staff all the way down, saying, look, I'm a badass doctor. She is amazing, she's really, really good, and she cares about mental health. And I think that message top down is quite powerful, and it has made a difference in our trust, because I know from talking, because I don't work as an ambassador because I'm doing the other stuff I'm doing, but I do work with her and kind of help with some of the stuff. And she said, the number of people that have come forward, male and female doctors, said, can I have a chat with you? It's unbelievable. And then she's not there to treat them, of course, as they're not fixed, we said before, but then she can put them into the support services that we've established and actually get people the support they need. So they will come forward. I think just keep doing what you're doing, and it does take time.
Brilliant. I've got Emma Marshall. Emma, I think the question has sort of been answered, but do you want me to ask it for you? You're okay to ask it yourself? If Emma Marshall is there. I'm putting people on the spot, I know that. I can put it towards Alex for you. Why does Alex think that people leave it so late to seek help with mental illness, mental health? The stigma is still significant, even though we've moved so far to break down taboos.
Yeah, I think if you look at young people, particularly, often it's barriers to access. So if you're young, I'm just taking this example because it's quite easy to kind of see it, is that young people, if they feel like they're struggling, they need to put their hand up almost to speak to a grown-up. The grown-up then needs to take them to a professional, the teacher. The teacher then refers them off, if they need it, onto a service. And that process means multiple people they need to tell their story to, and often means that there can be quite a wait between that time to actually accessing it. And then when they get to the service, for example, CAMHS, sometimes very much appropriately, but sometimes it might not feel that way for the person. It's not the right place for them to receive their treatments. They feel that there's an element they might be rejected. So after all of that, they might reach this level of rejection. And I think all of those elements added on to the social stigma around talking about mental health and the feeling of like, oh gosh, there's something wrong with me, I think means that people don't access service. Because it's interesting, isn't it? Go back to the analogy around the ankle. If you hurt your ankle and your ankle wasn't working, you were limping away with your ankle, you wouldn't go like, you wouldn't feel a stigma about going to get your ankle sorted. But you do feel that stigma around mental health. I mean, look at forget pre-COVID, probably a terrible example, but if someone has a cough, how long do they wait with a cough before they come and see the doctor? I mean, in reality, you would think a certain amount of time, but actually, it might be day one and they're coming in with a cough, and they're not actually unwell, and I'm not saying that people come before they should, but coming with a cough, but how long will they take before before they'll come forward with mental illness? And it's absolutely right, as I said at the start. Men will sometimes wait until they're suicidal, and often not even then. And when they're having suicidality, they're thinking about suicide, they're thinking about very dark thoughts before they'll speak to anyone. And that's why it doesn't actually surprise me that it's a decade on average that before people come forward. I mean, how many people I suspect on this call might have a bit of anxiety or whatever, but they just kind of park that, And I parked mine for a long time. And I thought, well, actually, I look back now, I think, geez, I tolerated really bad levels of anxiety for many years, and I just put up with it. But if that was my ankle, I was limping for 10 years, I would know where to put up with that. But it is impacting my day, and it was impacting my day just as if my ankle was limping. But because you can't see it, you don't deal with it. But if I'm walking along the street limping, I think I've got to get this sorted. It's an interesting fact. It sounds, it's an interesting thing to think about, and I think that is a marker of where we're at as a society. And we are making improvements, and undoubtedly we're making progress. I really do feel that we are. Sometimes it's hard to feel like that, but I think we are. But we've got a little way to go, I think.
Brilliant question. Thank you very much for that, Emma. We've got one I've got Adam Baldwin next. Adam, feel free to ask the question yourself, or can you put it towards Alex for you? I think, okay. I'll read it out for you. It says, in my limited and non-clinical experience, I found that physical issues around addiction, alcohol, drugs, and food are generally symptoms of an underlying mental health problem. We focus on the physical issue and the actual addiction, but in my impression, not the underlying cause. Any thoughts on this observation? That's from Adam Baldwin.
Yeah, I think we talked about it a little bit already, but yeah, I think so much of it links between the two. I said I don't think you can separate two very easily. If one thing will affect the other, and I use the example early on. So it might be like you're really depressed, and your depression leads to drinking more. You get an addiction to alcohol. The alcohol damages your liver. You end up in A&E. I've seen it many times where people come in with acute liver issues on a background of chronic illness with their liver. But what's the problem? What's the diagnosis there? Yes, okay, it was a liver problem. We were diagnosed as alcoholic liver disease, but where's the problem? What actually started it? I think that's the thing that I'm really interested about, is digging back and going, where was the starting point? So if we'd have dealt with that person's mental health issues, or they felt that they could have come forward and got the support, would we have got to the end point where there's a physical presentation? Because actually that physical presentation of illness is a result of a mental illness. And I think that's the and we've tried before to go focus in on right, how do we deal with this liver issue? And refer them off to the liver specialist, they'll fix that. What about the mind? What do we do about that? Because that actually is what caused it all.
Brilliant. Thank you very much for that, Alex. We've got some hands up here. We've got Coral Lewington and I've got Amulet Halliwell. I've got your names down because you banged in some brilliant questions in the chat box. So, Coral, should we have you go first? Do you want to step up?
Thank you. I'm just looking for my question. I think I've asked a lot in the box. We run a social media mental health support page. It's Deep Breath, Small Steps, and that was following the loss of my lovely dad to suicide. We support around 40,000 people, and even though we're fully inclusive, over 95% of those are women. I know you have covered this quite a lot, but are there any specific support services you would recommend for us to signpost to men? I know Hub of Hope, of course, but anything like we particularly like Calm, but anything that you would recommend that would help us to tailor our service to men?
Well, first of all, I'm sorry for your loss, and I guess amongst the pain of that, you should be proud of yourself to be supporting so many people and doing what you're doing. which I imagine is not easy on any day. So I think it just highlights that issue, doesn't it? Like, we have a real problem where men won't come forward, and I think part of it, you're right, I think is about thinking about what support will they reach out to. I take, for example, children, Shout, which I'm sure you've heard of, text service. Such a great idea, because children often have their phones and they might not feel comfortable calling, seeing someone in person. There's not everyone, I'm just saying, for some children, but they might feel happy to text a service where they get a reply and they can kind of walk through that because they feel in control. They're not being put in the spot. They can take time to reply and answer, and it makes them much more comfortable to come forward. And Shout have had huge growth and demand really from people then hearing about it and using that service. And I sometimes wonder with men, it's looking at services that kind of, because a lot of it is the stigma, and it's like coming forward and all that. So how do we point at services that maybe tailor better to men in that way? And it's difficult. I'm not going to answer the question that well, because I think the answer, it's about what is the answer? How do you get people to come forward? You can't force people to come forward, and sometimes and often you don't know the people that are struggling or who they are and how for them to come forward, because of course, we know with men that often when men take their own lives, it might be the first presentation of their illness. Women, on average, will present to A&E and other services between 20 and 30 times before they might take their own life. But for men, it might be the first time. So there's like a self-selecting group, isn't it? The people that have come forward are the ones that are engaging. So therefore, how do you engage with the ones that haven't? And I think most of that is actually wider arching campaigns. It's changing narrative amongst in society and tackling toxic masculinity. I don't think there's a quick answer, but I think in terms of engagement, it's what will men most likely engage with? Let's target our social media campaigns around that and hope that they come forward.
Brilliant. Thank you very much for that wonderful question, Coral. I'm aware of the time. I know we got Amulet's question. Can we take Amulet's question? Is that all right?
Yeah.
Amulet Halliwell, are you all right? I know they had their hand up. Amulet, do you want me to read out your question, or are you okay? Can someone speak to me? Because hi, Dr. Alex. I'm a HCA for palliative care in the community. Can you give us any tips on how our male patients can start conversations around how they feel with the loved ones? Many patients are afraid to upset family and approach that conversation. Amulet, thank you very much.
Yeah, I think it's. I was actually having this conversation before this call. I had a different call. We're talking about like kind of grief and illness and like conversations around illness. And we actually are getting a lot better. And sadly, the pandemic has, I think, opened us all our minds more to the conversation of death. And I think we're getting better, but I think it comes from a low ebb of talking about it, because it's something we don't like to talk about on the continent. In Europe, actually, they're often much better about how to talk about it, and it's something that happens to all of us. And I think it's something that hinders us often. Even people talking about their will and what will happen should they pass, what they want to happen next. How often would it be that you have that conversation in a family? Often it's just kind of left quietly. The will's done, and then you won't know about it till afterwards. I think in terms of talking so I think the questions around the person who is unwell talking to other people, I think it's very much gauging what you think is appropriate based on their age, what they think they can tolerate, what they want to hear. And sometimes I think asking is almost like how we approach as doctors talking to people in difficult scenarios, but breaking bad news. What do you want to know? I think it's an important question. What would you like to know about what's happening, about my illness? And finding out, because sometimes you give too much or too little. So it's like, what would you like to know? And making sure, obviously, again, that you're in a setting that is appropriate to ask that kind of question. You've got time to speak to them. And then I think it is really, going based on what they've said and what they want to know. It's sharing what you want to share. Like, what do you want to say? What is important to you? And maybe writing some of that stuff down, and having it down on paper before that conversation, the things you'd like to talk about, either about your illness or about life, or anything messages you'd like to say, so that you don't miss anything. Because often when you're in emotive scenarios, and I do it sometimes when I'm going to talk to a patient or their family breaking bad news, sometimes I'll just jot down the main things I want to make sure that I've said in that conversation, because when you're in the middle of it, you get lost sometimes. And just taking time then to reflect afterwards. Did you say everything you want to say? Is there anything further? And making sure that you've got across everything that you want to. It's a difficult conversation, isn't it? But it's an important one.
Brilliant, thank you. I think we've run out of time. Jade, have we run out of time? You're going to have to confirm for me.
Yeah, so we are at the end of the session, unfortunately, and I feel like we could probably go on with this endlessly because it's such an interesting conversation. And but I am aware that Alex, obviously, you've probably got other commitments after this, and yourself, Kofi, and the rest of you on this call. So, I mean, from my perspective, and certainly on behalf of the health and wellbeing team at Humber, Kirsten and Vale, I honestly can't thank you both enough for coming and presenting today. It's been such a fantastic conversation, and thank you everybody for coming. We know that our uptake with men's health events isn't as high as it is with some of our other events, and we really encourage you to encourage your colleagues, your friends, people that to come and join in on these sessions. I know how busy everybody is, but honestly, I think they're of such benefit, and we will be posting the recording on our men's health page, which I have posted further up in the chat. There's still lots more sessions this week. There's some fantastic stuff. We've got stuff around sleep. We've got the amazing Gareth Thomas, the rugby player, doing a talk tomorrow for anybody that's interested, but there's still loads more men's health stuff going on this week. So I will post that in the chat. And also, if anyone's got the time and is willing to fill out the evaluation form for us. I know how busy you all are, but honestly, any information on what you want to see going forward would be amazing. And I have put the link in the chat a few times for our resource page. Like Alex mentioned, Hub of Hope is amazing, but we've got links to all of the support groups in the region. If anyone wants anything added to the resource page, please just email me. Most of you have got my email, jade.jenkins4@nhs.net. But thank you, honestly, thanks Alex and thanks Kofi. It's been really fantastic to chat with you.
Thank you, Kofi, for
Alex, I would like to say Coral is very concerned about you. I'll also add this at the end, and I think this is a really nice message. I saw this come through. She said, Alex, do you feel like you are at the risk of burning out yourself? Do you feel like you are sufficiently protected from that with the techniques and the support that you have? And I was thinking, yeah, you're so busy. I hope you're taking care of yourself as well.
I have strong boundaries. I create boundaries, very important. I create boundaries, and that's how I protect myself. I protect my weekends, I protect my downtime. And that's how I look after myself. But thank you. That's very kind of you, Carl. Thank you.
Awesome. Guys, thank you very much. Alex, thank you very much.
Good day.
Awesome. Cheers.
Thank you. Thanks,
Cheers.
everybody.
Bye. Bye.